ignition sources, a number of different ignition sources, cautery, lasers, light scopes, drills, saws, all that good stuff, okay? Making sure that when we are using those instruments that we're utilizing them appropriately. Don't lay it on any of the drapes. Again, keep it in standby when we're not using it. I'm told that it's a policy, and it honestly makes sense. I don't know why we would need to have a policy on it, but if you're utilizing a laser, you use lasers here. Okay, so if you use lasers, that you keep the area around the site wet, right? And then I'm also told some senior nurses that if it is a high-risk case, they'll have their water like literally close by. Not within the corner of the room, but literally like with almost attached to their hip. That way, if there is a fire, right, I can simply utilize the water instead of trying to run for a fire extinguisher or find another blanket or whatever it might be. You have the water that's available to you. Okay, fiber optics, lasers, again, all those things. We don't have to spend a ton of time on that, okay? All right, so we have some realistic scenarios. A fire in or on the patient, a fire within an adjacent OR. Okay, what are some of the things that we should at least be thinking about? And then a fire within the hospital, what are some of the things that we should be doing? So a fire within the actual OR suite is a relatively high risk. So I always like to say that if you can shelter, if you can stay, you stay. Okay, it is only when the room can no longer sustain life. Like that little voice in the back of your head is saying, you know what, this is really no longer a safe place for not only us, but our patient, then we may have to leave, okay? But I've always been told that it's okay to stay. We put the fire out, you may wanna continue with the case. Until you get the case done, then they can figure out what happened after that, all that good stuff, okay? Because as soon as you step out into the hallway, we don't control anything, okay? And even more so when you evacuate, and we're gonna see that when you evacuate, you may be going to an unconventional space, okay? All right, so anytime there is a fire in or on the patient, we're yelling out, fire in the OR, turn off the gases. Again, it's not a negotiation. We cannot stand there and argue while the fire is occurring, okay? And so if you think about running out into the hallway, trying to find the valves, it takes up too much time. So right at the machine, they turn off the gases. So for our anesthesia providers in here, right, knowing ahead of time where your ambu bag is or where your bag valve mask is I think that probably should be one of those mental checks, right, as you're going down through as a part of that case. Where's my ambu bag in case I need it, okay? Now at that point, right, everyone's gonna get super busy, and we'll talk about what some of those steps are for if I'm circulating, if I'm scrubbing that day, what that might be. But we have to initially get those gases shut down. Hopefully it stops that flow of oxygen, puts the fire out, and then we can deal with it after that point, okay? Again, if it's on the patient, I'm gonna demonstrate what that looks like with a fire on a pad, and you can all, practice that, putting out that fire. I can show you what it looks like, but I'm more of a hands-on person, okay? So it's easier for me to learn that way. So I'll have you practice putting out the fire, and just makes it a lot easier, okay? So at this point, if the fire is in the ET tube, you may or may not decide, again, to leave. So at this point, if the fire's on the patient, right, we may put the fire out, we can stay, do all that good stuff. But if the fire's in the ET tube, it may be better off that, obviously if we have to leave, then we can leave. We can go to another OR, we can go to an unconventional space beyond the fire door. So again, if the fire's in the ET tube, we've got to get the gases shut down, disconnect, pull the tube out. If you're scrubbing that day and you have your saline that's close by, you need to bring the saline or the water over to the anesthesia provider. They can't really walk away from the patient trying to find the water because they need to put the tube in the water. It might still be on fire, okay? And, right, they may actually need to re-intubate that individual, okay, based on those conditions. So is there any questions or anything about that? I just want to make sure that's clear. It's not muddy. Okay, so now here's what it looks like if there's an actual fire within the ET tube. Again, if they were to pull that tube out too quickly before turning off the gases, now we're holding on to a blowtorch. So again, what is your responsibility, right? What is your role during that emergency. So again, if we are going to leave the OR, then our circulator, okay, we need to make a call. So who do I call? Please don't tell me Ghostbusters. Okay. Who do I call? Who should I call? Anytime there's any sort of problem within the OR. Do you always have a charge nurse that's around? Potentially, okay? Or we have to dial the emergency number. So what's the emergency number here? 2. It's very simple. When you get over into the other Methodist hospitals, it's not really consistent, right? Each building is just about a little bit different. So I like that, having just 2. You just pick up the phone and dial 2. So what do I tell them? Right? It's 4 2s. Oh, it doesn't say that in your. Okay, 4 2s. Thank you. All right, cool. 4 2s in actual procedures. It only says 1 2. All right, cool. All right, 4 2s. We'll make sure we get that changed. Now, what do we tell them? Yeah, whatever information you know. Okay, because they in turn should be calling 911 on our behalf. Okay, and I don't know if you've ever called 911 in your entire life, but they ask a lot of questions. And think about it. If you're responding to this building, right, you're the firefighters, they're going to be asking a lot of questions like, where's the fire? What's going on? Have you evacuated? Is there anyone injured? Is everyone accounted for? There's a number of different things that they're going to be asking. So if you can provide that information to the switchboard, the better off everyone is going to be. If you're scrubbing that day, you can help the surgeon, especially if you're evacuating. Now, thinking about like sterility, right? At this point, sterility might be out the window. Okay, so there's a fire in the room. We necessarily can't stay. We're not going to stay. We don't necessarily have time to close. So you have to cover the site, or you can utilize an IO band. Okay. Now, when the circulator, when you're done making those phone notifications, okay, at some point we're going to have to activate the alarm. And so, where are those pull stations located? Don't tell me in the building, I already know that, or on the wall. Where are they?
Outside the ORs.
Okay, so potentially outside an OR, but even more so, right? They're near every single exit door here in the building. So if you have a stairwell that's close by, right, you have to get to the pull station and pull it. Now, what were we taught about those pull stations as kids? Don't you dare touch that ever, right? You're gonna get in big trouble. Well, if we don't pull the alarm, right, then who's not coming, right? The fire department, the help. Nobody knows. And so this is where it gets a little gray, okay? This is where it gets a little muddy. So the policy is, for any fire, we activate the alarm, right? However, what if it was something that was like, the machine was like doing something funky, right? Maybe something happened with it and I turned it off and the problem went away. That's where it gets a little muddy. My answer is always going to be, we activate the alarm if we think there's a fire in the building. Okay, that's always our appropriate response. However, it gets a little gray there. I just want to let you know that. Okay? You may have questions about that later on. All right, and so at this point, if you can move the patient on the OR table, that is the best way to actually move the patient. However, there are some instances where you just can't do that, like cath lab. If you unplug the table, the OR table, and for whatever reason it doesn't come to wheels and we just can't move it, right? So in that instance, then we have to get the bed and bring the bed in and transfer that individual over quick to get them out. Okay, again, this is not like, a 4 or 5 minute process. This is like a 45-second process. This is how fast that should go. Okay, and I think that you should all be able to manage that, even based on, I've seen it where even open heart cases, we've practiced that, and we've been able to manage that in under a minute, okay? Okay, if the fire is in a piece of equipment, honestly, we shouldn't really be spending time. If the piece of machinery or whatever you have in the room is on fire, let's not spend a ton of time trying to take apart the machine to figure out why the fire started or trying to utilize the fire extinguisher, okay? We'll talk later on once we get upstairs as we're going through really how we work through this process of evacuating. But if you have the opportunity where you can utilize the fire extinguisher on a piece of equipment, I'm absolutely okay with that. Okay, and we'll talk about what some rules are that are associated with the fire extinguisher. But again, we're gonna shut off the gases as quickly as we can, and let's do the right thing for our patient. Okay, so really, what's our role? What's our responsibility when there's a fire in the room? Okay, and again, we don't have time to go to a book and look up some of that information. We have to know, like my responsibility is circulator, my responsibility is the scrub tech, okay? Getting the table to wheels, making sure that everybody understands how we get the table to wheels. In some cases, it's not always the easiest thing, okay? Especially if it's not working right. So eventually what we need to do is we need to get the door closed, okay? We need to get the door closed because the smoke, if we don't contain the fire in the smoke, where does it go? Out into the hallway. And the hallway is your safe place, okay? So the faster we can get everyone out to a safe place, the better off you're gonna be. We'll talk about the oxygen once we get upstairs. Again, knowing what to do when there's a fire next door in an OR, right? Do we stay or do we go? And it's all based on, I haven't seen the ORs because I've never been here before. Do they share a substerile room in between? Okay, so if they share a substerile room, that means that if the neighboring OR is on fire, that means that we have to do the same exact thing. If they're gonna evacuate, that means we go too, okay, if we're in that space. Because there's no firewall, there's no fire doors in between there. Yeah, there's a door, but that only provides us with very limited, okay, protection. Okay, we'll get the fire alarm sounding, etc. Fire somewhere else within the hospital. Again, it's fire in location and then there's race. Race is really race no matter where you are in healthcare. It's just doing the right thing for our patient, okay? So again, our first thing is, don't worry about, sorry about code red, it's really fire here. Again, running through, getting our patients to a safe environment. Again, activating the alarm as quickly as we can and calling the operator. Okay, please, again, 4 twos, don't call 0 because that just goes into their queue, right? And you can imagine how many phone calls they probably get here, right? So we don't want to be trapped in the queue for an emergency. So 4 twos. All right, we need to confine, close doors, move equipment out of the way, and then we eventually evacuate. Now, it's all depending on the conditions that are in the hallway. If there's no smoke, we may choose to evacuate several ORs. Or if there's a lot of smoke in the hallway, then we may choose to shelter in place. Again, it's all based on what the conditions are. So again, you're just a little bit unique in that most hospitals that I've been to, usually the ORs can evacuate to like PACU. PACU can evacuate to the ORs. Again, you're a little bit more unique here in that you can't do that. So any OR, I guess ORs 1, 2, 3, 4, you can't evacuate to PACU. It's in this same, right, compartment, okay? So where do we evacuate to? OR 7 or 5, 6, 7, 8. We need to get beyond the fire doors, okay? So we've got a set of fire doors here. Looks like we may have a set of fire doors here. Again, if we can't, for whatever reason, get to the OR area, then we may have to go to the emergency department, or we need to get ourselves beyond those areas. Any questions on that? I just want to make sure that isn't muddy. Looks fairly clear, right? Okay.